Okay, welcome to the latest presentation in the National Consortium of Telehealth Resource Centers webinar series. These webinars are designed to provide timely information and demonstrations to support and guide the development of your telehealth program. This is a recurring series. It happens every Thursday of each month. My name is Joe Schaffner, and I am with the South Central Telehealth Resource Center. I will be your host and moderator for today. A little bit of housekeeping, please mute your microphones. We are recording, so if you are not already muted, you can see the microphone icon next to the video icon. If you can see that, if you can press that and mute, we would greatly appreciate it. So today, for this event, for this webinar, we are offering continuing education credits. And we are doing that in conjunction and through a partnership with the Connecting Across Professions program at the Institute for Digital Health and Innovation at the University of Arkansas for Medical Sciences. And if you have any questions afterwards about the Institute for Digital Health and Innovation or the educational programs, feel free.
Emily, will you get me a glass of water, please?
hi@uams.edu. All right, so to obtain your continuing education credit for today, if you have a Cloud CME account, you can text the activity code on this page to the number 501-406-0076 to claim your code. If you do not have a Cloud CME account, you will have to go to learnondemand.org, create an account, search for the event by using the code NCTRC, and then you must complete this registration before 3 p.m. Central Standard Time tomorrow, Friday, July the 17th. So that's very important. Okay, so a little bit about the accreditation. UAMS is jointly accredited through the Accreditation Council for Continuing Medical Education, the Accreditation Council for Pharmacy Education, and the American Nurses Credentialing Center. And this event has been granted one AMA PRA Category 1 credit. So the ANCC designates this event as a maximum of 1 contact hour. The ACPE provides pharmacists up to 1 contact hour. And the AAPA designates this event as a 1 CME credit activity. So again, if you have a cloud account, Cloud CME account, text this code to this phone number, 501-406-0076. Otherwise, you'll have to create an account on learnondemand.org, look for the search by the code SCTRC, and do it before 3 p.m. Central Standard Time tomorrow. Disclosures: the following planners declare no financial relationships to disclose that relate to this program: Felicia Williams, Cheryl Washington, Melanie Meyer, Jane Bellondo, Crystal McRae Lewis, Amber Govan, and Leslie Stone. So with that, this is our presentation for today. And I will say, between working through different partnerships and programs, the topic may have gotten a little bit revised. I'll leave it up to our presenter, Ms. Williams, to clarify that. Our objectives today are to identify opportunities to reduce friction based on the consumer journey, discuss highest value marketing channels based on consumer data, define audience segments, and outline conversation goals. So before I turn it over to Ms. Williams, I want to briefly talk about the NCTRC, the National Consortium. All right, so we are a here we go, maybe. Getting there. All right. So the NCTRC, there we go. All right, so we're a consortium of 12 regional TRCs. My region is there in red, Arkansas, Mississippi, and Tennessee. You can find your region by going to the National Consortium of Telehealth Resource Centers website. There's also a wealth of other information, previous webinars, a lot of good resources there. So I want to encourage everyone to go there, make contact with your local TRCs, and look at what information is available. Like I said, again, please mute your microphones. And if you have questions, please use the Q&A versus the chat function. As it's being recorded, if this allows us to follow up on any questions not being answered. So please use the Q&A function. And just FYI, this recording will be posted on the NCTRC's YouTube channel. That being said, I would love to introduce Ms. Felicia Williams. She is the Digital Marketing Manager for HCA Healthcare. She leads the strategy, management, and deployment of the enterprise digital marketing initiatives with the HCA's Physician Services Group, focused on consumer-facing digital platforms, including paid digital media campaigns, website strategy and content optimization, search engine optimization, online listings management, email marketing, and social media strategy. Williams focuses on identifying the delivery strategies on an enterprise level to support the growth of HCA's digital marketing programs in alignment with the business goals for each business unit and service line. That being said, I would love to turn it over to Ms. Felicia Williams.
Thank you so much for having me. Let me know we can see my screen.
Yeah, it looks great.
Great, awesome. So I have two screens here, so if I look like I'm not looking at you, bear with me. So as Joe said, I oversee digital marketing for HCA Healthcare. I'm really fortunate to be able to work across 4 very different lines of business. As most of you all may know, we are the largest healthcare organizations in the country. So we have hospitals, physician practices, urgent cares, in a lot of different markets. And we also manage some physician lines of business, so physician recruitment and graduate medical education. And so I really get to oversee how we have a consolidated digital strategy across all of those access points. So today I'm really going to focus a lot around direct-to-consumer strategies, really out of the experience of telehealth in urgent care setting and physician practice setting. We also have a pretty large footprint of telehealth services in our hospitals as well. But when we think about marketing and reaching consumers, the outpatient settings typically tend to be where marketing can have the most impact. A lot of times if you're using telehealth services for inpatients in the hospital, you don't have to market it. They're already there. So that's what we're going to talk about today. So from a search perspective, we always start with what is the consumer demand? How are consumers shifting and changing? And particularly around the last several months with the COVID-19 pandemic, we've seen just an explosion in consumer interest and demand for COVID-19, for telehealth testing. You can see the search trend here just over the last 5 years of patients looking for a telemedicine doctor or doctor on demand. And really what we're seeing that uptick as a result of COVID is more in that transactional space. So people aren't necessarily searching for information about, what is telehealth, what is, virtual visits. It's really, doctor on demand, telehealth doctor, virtual appointments near me, the more lower funnel type of searches that are happening as a result of the pandemic. So when we think about, how do we market, how do we reach people, the biggest thing is focusing on the right people at the right time in the right way. So we know that the consumer journey can differ, but in a lot of instances, it starts with search, it starts with that demand. So we think about, maybe 5 years ago, we've had to work hard to make patients aware of what telehealth is, how it's helpful, how it's beneficial to them, but all of the recent data shows that people know that we no longer have to educate and make people aware. It's really more of how do we get that in the hands of a consumer or serve that up to them when they're ready to take action, when they want to be seen, when they need a virtual visit. So what we're going to talk about today is when you're thinking about outlining your digital marketing strategy to reach those telehealth consumers, we're going to talk about defining your audience segments and outlining your conversion goals. So, who do you want to reach and what do you want them to do? Depending on your setup, that could be a number of different things. And then discuss the highest value marketing channels based on consumer data. So how do you reach those people through the most effective mediums to accomplish those goals? And then identify opportunities to reduce friction. So this is really where digital marketing and digital experience kind of blend worlds when we think about driving patients to a product, a digital product to complete their virtual visit. Are there opportunities where they're dropping off or where that experience is not good for them? We think about how consumers are so used to experiences like Uber and Amazon, and often healthcare is, not quite that way. As we all know that it, can sometimes lag behind other industries in terms of technical, advancement and technical strategy, because we're so focused on that in-person, high-touch care. We forget about the digital experience. So when we think about, how do we define and align on our marketing goals? Obviously, we have a lot of different folks on this call. Some of you may be in operations, some of you may be on the clinical side. But we think about, marketing supporting the business strategy. We think about, the good old consumer funnel. So, get people in the top of the funnel to get them to the bottom of the funnel to convert. And so ultimately, we want to make people aware that we offer telehealth services or that our provider is offering this. But more than just making them aware, we want them to take action. And that's where that middle of the funnel comes in for those marketing conversions. So those are actions that we can track and quantify and measure that are contributing to volume. Because at the end of the day, marketing is here to help grow the business agenda and volume growth. And so if we want to market our programs, the goal is to get more people to complete telehealth visits and experiences with our providers. So when we think about, if we have our goals, our goal is ultimately to get them in the door. So everything that we are targeting should be focused on getting them in the door to complete the visit. And so marketing can really help support those strategies. And we think about, who's our audience? That's going to differ very much based on a couple of different things. Your care setting. So if you are in urgent care, that's very consumer driven, direct to consumer. People are searching, they're coming in, they just need care right now. That experience and that audience is going to be very different. Typically urgent care skews younger, people who are, on the go, looking for convenience, looking for, to feel better fast. Versus, your typical, primary care patient who has multiple comorbidities, who needs that relationship with their doctor. Their telehealth experience and how you reach them with telehealth could be very different. If you're an established patient of a doctor, the way we reach you is going to be very different than that urgent care consumer who's just looking for, a quick video consult with a doctor that they may not have a previous relationship with. I did briefly mention inpatient experiences as well. If you're a hospital or a health system, you may want to, generate awareness and utilization of your inpatient telehealth services. And many of those are referral driven, and a lot of your efforts to get the word out about your telehealth services may not be direct to consumer. They may be more of a B2B approach where you're reaching out to other referring physicians who are sending people to your hospital, sending people to your specialists, letting them know about your telehealth services. So that's the number one consideration for how do you define your audience, who are you going after? And then similarly, your service line focus. So are there specific areas of the business that you're trying to drive? Are you focused on just truly episodic urgent care encounters? Hey, I'm sick. Hey, I'm worried about COVID. I need to do a telehealth visit. Or is it, follow-up care for our cardiology patients or psychiatric consults? All of those service line pieces have different considerations when you think about how to reach that audience. And so outlining that consumer journey and what you're trying to do, who you're trying to reach, is going to help you narrow your target and hit your target. And then I mentioned specialty as well. We at our hospitals and really, all of us understand that certain specialties are more consumer driven or less. Patients don't, Google, I need a brain surgeon today, and go and book an appointment, get a brain surgery. There is a path to purchase, if you will, for that patient. And so as we're thinking about growing volume, consider that patient journey and the specialty that you're focused on. Again, the consumer may not be your primary audience. And then your business model, this is another piece, again, depending on your care setting, if you're a hospital, if you're an urgent care, if you are an independent small practice, if your goal is to go out and get new patients in the door, that could look very different in your marketing strategy versus if you are trying to keep your existing patients and offer a new service to them or offer a more convenient way of delivering care to them through telehealth. So again, each of those pieces have different, financial implications and what it will take to reach those folks. So, if you are thinking about a paid media strategy, patient acquisition is really where that should be focused, to go out and get incremental new people to come into your practice, to come into your urgent care or your hospital, and then keeping the existing patients that you have, keeping them engaged, keeping them loyal, and maybe gaining incremental visits from them because it's more convenient, or maybe the only option for them amidst the pandemic. And really the next step, after you've defined your goals, you've defined your audiences, to map that consumer journey. And this is just a very small example from more of a retail perspective, but I wanted to visualize it because it's a lot more complex than this in healthcare based on all of those factors we just went over. So that patient's journey from, hey, I'm sick, hey, I need something, I need to see a doctor, I need to see a provider, to actually getting into completing that virtual visit can look very different. So it's really important before you even start to think about marketing is to map out your consumer journey and identify where are those points where we can impact the patient. And this really bleeds into your journey once you get them. So, there's the journey for patients to say, yes, I need a virtual visit. And then once they get into that experience, what is that actual physical experience like? So is it clunky? Do they book an appointment ahead of time? Is it a, link and launch experience where they're able to essentially directly access a telehealth visit on demand? Is it, a scheduled visit? There's all these different factors. And we've really seen, particularly through COVID, that providers and healthcare systems are really adapting and flexing in different ways. And one thing that I think is really critical is to think about the patient journey throughout that entire continuum. So as a follow-up activity to mapping that patient journey to actually start a telehealth visit with you, then you start to lay out the patient journey once they initiate. So thinking about pre-visit, how their appointment booking, what does that experience look like? What we see really in healthcare a lot of times is a mix of old school and digital. We have these great, technologies, but then we still use pen and paper when they get into the practice, or we fax things, or we pick up the phone and call, which are not bad things at all. But looking at it across your, experience is really important to identify where are there points of friction. I know that, many providers are experiencing very large swings in, very low volume amidst all the shutdowns, and then maybe extreme demand and extreme volume throughout, the recent surges of coronavirus. So all of those pieces give you an opportunity to assess, can we be more efficient? Is this providing frustration for the patient? And then throughout that process, how do we continue to make that a smooth experience? Because if your goals are to grow telehealth visit volume and then to keep people coming back, it's really important that you give them a good experience. If it's frustrating for someone, if it is difficult, if they drop off, if there's technology challenges, if the platform that you're using is not user-friendly, if your provider has connectivity issues, it could be a really bad experience for the patient. And with the post-visit piece, it's really important to gather that feedback, whether it's your surveys or reviews or however you collect that in your organization. But that's going to give you really valuable insight into, where can we improve the process? Where can we make sure that, our process could, have less friction? So that even goes down to the billing and collection piece. There's been a lot of volatility in how we, communicate to patients about their visit, how much it's going to cost, if they have to come in, does it cost more, does it cost less? So there's a lot of opportunity to, make that experience really great for patients, but also a lot of opportunity to make it not so great. So after you've kind of outlined your goals, outlined your audience, outlined, all those considerations that you need to make, mapping out your patient journey and then your care journey, where can you reduce friction? And so we're going to talk about a couple of ways you can do that. And I would say, the note at the bottom is, marketing is really typically focused on the very beginning of the journey, and sometimes the end of the journey. But what we've seen work really well is when you have, marketing or communications or patient experience, thinking about the patient throughout that entire journey. And so if we're marketing for selling a product that is less than optimal, it's going to be pretty challenging. So the more we can continue to put that consumer, at the forefront and really make sure that what we're developing, what we're putting out there is beneficial for consumers. It really builds trust and credibility with your audiences when you can provide a really reliable, really slick virtual experience, particularly in a time where people, have maybe a lot of fear and uncertainty. Having that confidence in their healthcare provider that they can see them and take care of them is really important here. So we think about, if we've got all of those things that we've considered, our audience, our goals, then how do we tactically, develop a marketing plan? How do we reach out to those patients? And really the answer is, all of the things as it makes sense for your organization. So a multi-channel approach is really important as you think about all those different ways patients can journey into your organization. So it's not just one thing. It's not just your websites. It's not just social media. It's not just your patient portal or inpatient outreach. It's not just advertising. It's really how all of those things work together to reach those patients. And so as you're defining your audience goals, you may find that your existing patients, if that's your goal, is to reach those past patients and keep them loyal, keep them engaged, email or your patient portal may be a really great way to reach out to them. If your goal is patient acquisition, it may not be a good idea to purchase a list to text people who've never seen you before. So when you think about each channel, really break down, what are our goals? What are the goals of each channel? And then you can start to put together a comprehensive strategy. The most important piece there is not trying to boil the ocean, not trying to tackle all those strategies or all those tactics at once, but really prioritizing. So when you think about your highest value channels, the best way to do that is determine which channel is driving the highest conversion rate. So if your conversion rate is, the people you're getting to actually click and book an appointment or click and start their visit, or even better, if you could measure and attribute volume, actual, patient volume to a channel. So for example, if you send an email and to all your past patients, and you can measure anyone who got that email who actually came in for a visit or had a virtual visit, that's a way to measure success. Historically, marketing, prior to the digital era was not, you weren't able to measure a lot. And so now we can measure pretty much anything. And so there's a lot of value in that, but often our organizations, have to kind of wrap our arms around how do we measure what's working, what's not working, and conversion rate is going to be the way to do that. And then what channels are the easiest to execute? This is something that we kind of forget about sometimes, but the COVID-19 pandemic really made that just super in the forefront because we're moving quickly. A lot of organizations are trying to stand up telehealth very quickly or iterate upon it really quickly. And so if there's something that's easy to execute that we can stand up, that's valuable, that will reach those consumers, that's another consideration as well when you think about tactically what channels do you activate in. And then what channels drive the highest ROI or return on ad spend? So if you are advertising, it's really important to have a really solid measurement plan to determine how much are you spending, what are you getting back from what you're spending, and going back to that final slide, if you're spending in awareness, there's no conversion point for awareness. If you are, if your goal is just to make people aware, you're not going to be able to calculate, a very concrete return on ad spend because there's no action for them to take. But if you're focusing on our goal is to get people to click and to book an appointment or to click and to start their visit or fill out a form, those are your conversion points that you can measure against to say this drove incremental value to our organization from the spend that we did yield. And then what are your most efficient for your resources? So depending on your organizational setup, you may have massive marketing teams, you may have one person, you may have half a person. So all of those considerations are really important as well when you think about resource time. So it's not just ad spend, maybe it's an SEO person who's working on your website, maybe it's a technical specialist working on your patient experience. So all of those things you want to consider in your the value of your channels. And I would say, the best thing you can do is to communicate and to kind of get your organization aligned that it's more than just ad spend. So we think about, your highest value channels and efforts. It very well may be, spending money on a contractor to optimize your websites or something like that. Maybe not necessarily advertising. So we think about how do we measure using those digital analytics to measure impact. So Google Analytics is really kind of the base level of where you should be looking to understand people who enter your digital experience. What are they doing? And so I'm thinking about, I liken, digital analytics on your websites to, your actual physical presence. So if you have a really great building, it's beautiful, it's on this amazing block, and people drive by all the time and they see it, it looks great. That's awesome, but doesn't really help you grow volume if people aren't coming in the door and seeing a doctor or getting treatment. And so your websites are the same way. It's really important to define an intent to visit conversion that is able to attribute value to what people are doing. So when we look at our websites and digital access points, that conversion is really valuable to say, people came and what did they do when they got there? So looking at conversion rates by channel in Google Analytics, you can see this is just an example of how you might look at it to see what channels are driving people to book an appointment or to do a telehealth check-in or to initiate that telehealth visit with your provider, however it may be set up in your organization. And then we think about, measuring your results. You also want to look at how do you measure and what do you measure. So to reiterate on some of those things, common success metrics are going to be those appointments booked, total visits, people calling. I know a lot of times, that's the only way that we can track or the only action that is relevant for consumers is just a call. And so click-through rate and open rates on emails are other ways to measure success. Low bounce rates on your websites could be a really good indicator that people are finding what they are looking for and it's relevant. So if you're driving a high bounce rate, people are hitting your page and leaving immediately, and that is not good. So as you think about looking for those points of friction, that's a great way to identify, when people move from this stage to this stage, when they start the appointment process or they start their telehealth check-in, they leave, they bounce off. And, additionally, within your telehealth experience, depending on what platform you're using, if you are, if people go through multiple steps within the process to register or to wait in a virtual waiting room or to receive the link to sign on, however that experience may be, you can use metrics like these to identify where those drop-off points are to iterate and to optimize. And then we think about how to measure. I've talked in a lot of technical details about digital marketing analytics that you can get from Google Analytics, other advertising platforms. And then I would also say your internal patient data, some of the quantitative and qualitative feedback is really important to survey your own patients, particularly if you're focused on, reaching existing patients that you have a relationship with. Oftentimes, primary care or other specialists have an older patient population, and so it's really important to understand their feedback and their consumer behavior. So your own internal patient data, patient surveys, focus groups, and online reviews can be a great source of information when it comes to how to measure and what to measure when you're looking at, is this working, is this not working, where can we improve? So I would recommend, a combination of both quantitative and qualitative data. But really at the end of the day, we think about how do we reach telehealth consumers. There's so many factors that can vary based on your organization, based on who you're trying to reach, based on the platform itself that you use, your own provider engagement. And so there's really no kind of toolkit or rule book that we can give to say, here are the golden digital marketing strategies. It's going to be very different based on your organization, based on your goals, based on the patients that you're trying to reach. But if you can work through kind of that process of outlining each of those different areas and thoughtfully documenting each of those things, it will lead you to a comprehensive digital strategy, not just for your marketing teams, but also for your technical folks that are implementing some of these things, your website teams, a really integrated approach to reach those patients and to provide them a good experience really falls into that marketing bucket. But more importantly, it's to grow your telehealth volume. Marketing is not the easy button. It may be, the hardest button. Operations, provider relations, your other stakeholders in your organization are really, really important because you can have the best marketing strategy in the whole world, an infinite budget. You can have, the slickest platform and patient experience, maybe better than Amazon. But if you do not have a good experience with that provider or with billing or with the organization, that's not going to help grow volume in the long term. So it's really important that your marketing teams, your digital teams, your operations, your provider relations are all working in coordination to create those comprehensive strategies to reach those telehealth consumers. And that's it. Any questions? Joe, I think you open up the chat or the Q&A.
Yes, let's see. Looks like we do have a question from Michael for the speaker. Any insight into the telehealth growth this year as it pertains to demographics, such as age, location, et cetera?
Yeah, great question. So what we've seen is this really interesting swing overall in the patient data of people who've said, yes, I would be willing to use telehealth, and people who actually did. And so every year we've seen more and more people say, oh yeah, sure, I'd use telehealth, but the people who actually do has remained like fairly stagnant. In certain areas across the United States, we've seen increases, obviously in that older population, the 50 to 70 age group, and that's a lot of your primary care patients who would normally go into their doctor's office and have that their regular visits. We've seen that growth in telehealth utilization, but it's really driven out of a replacement to the in-person visits versus a new demand in telehealth all of a sudden. On the other side, we are seeing increases in the younger demographics, not surprisingly, looking more for that episodic urgent care visit. So rather than going and finding a primary care or a walk-in clinic, they're more apt to spend $40 to have a doctor on demand or something like that. So in both of those demographics, we are seeing growth in different areas, but on the whole, kind of the middle generation, and we've not seen crazy growth.
Okay, thank you. We have one from Jean. What differences are there in marketing terms when it comes to marketing as a single entity versus a system-wide campaign?
Oh, that's a great question because I personally deal with both. I would say as a single entity, it depends on your footprint and your brand. It's obviously much easier to market as one thing versus having lots of different versions or lots of different brands out there. Starts to be clouded and to compete with one another. If you have a single entity that doesn't have a lot of brand recognition, if you're a smaller practice or a single hospital, it may be more difficult to reach audiences on a broader level. From a tactical execution, it's a little bit easier, but from a system perspective, there are other pros and cons. If you have variation in your brands, your access points, that becomes a lot more complex to market globally. And then additionally, if you have different points of entry or different experiences to have a telehealth visit through each of those access points in your health system. So for example, if you have hospitals and providers and your telehealth experience is different at either one, that's also difficult. So I would say the more you can align and I would say put more eggs in one basket or have a more unified strategy, the better, and not compete with yourself is really the best way to go. But they're both challenging in their own ways.
Okay, thank you. Have several questions here from Boyd. We have, to what extent will the reimbursement and the regulatory changes implemented during the pandemic to encourage telehealth remain over the long term?
Yeah, that's a really great question, and one I know that a lot of operators have been dealing with. I think the answer is we don't know. A lot of that regulation and how the reimbursement rates are going to change or not change are going to impact how health systems decide to keep urgent care or keep virtual care as a service or as an offering. Obviously, for health systems, it's got to be worth it to offer it to consumers. It's got to work financially, but also, it's starting to become an expected for patients that you just have to have a solution. So while, depending on which way the reimbursement rates go and how health systems can set it up and make the cost structure work, it can become just a standard feature that you just have to have, or it can become something that you're really focused on to drive revenue for your organization.
Thank you. We have one from Kevin. I've seen some pharmaceutical companies partner with telehealth companies to provide a link to telehealth services for those patients visiting for a healthcare provider. Has HCA had any partnerships to try and connect to patients?
We may have done some partnerships with pharmaceutical companies, but I personally, in my lines of business, have not been involved with that, so I couldn't answer that. It is very common to see more of that when we look at reasons for telehealth visits on the whole. Prescription refills is probably number one, number two in the top reasons people want a telehealth visit. So the strategy is definitely there for consumers, but we personally have not gotten into it.
Okay, we have one from Jean. What, in your opinion, is a good social media budget for a solid campaign, value versus outcome?
It depends, I think, on your footprint. When you think about social media, it is typically an engagement platform. You're really focused on awareness and engagement with people who are already familiar with your brand. It's a lot harder to reach patients who have never heard of you, never familiar with you on social. So I think your budget would just depend on who you're trying to reach. What I would say is if you're focusing on an awareness-based campaign, just purely making people aware of your services, you can get a lot done for a small budget on social media. If you're focused on acquisition, maybe a more lower funnel tactic would be more expensive, like paid search, but can yield higher return because you have people who are actively raising their hand and saying, I'm looking for telehealth. You can show up in that space and show up for those consumers versus people who are on social. They're looking at recipes, they're communicating with their friends, they're not actively in that I'm searching for care mode. And so your approach is awareness. So it's less expensive, but it's a different goal, I would say. So sorry, I can't give you a hard answer, but it depends on kind of those two scenarios and what you're trying to drive.
Okay, thank you. And we also have one from Yolanda. To target the younger demo, what platform other than Google should we use to reach those people?
It depends on how much younger. So, a lot of people get excited about some of the, new things that the super young kids are doing, the Generation Zs and Snapchats and things like that. But when we think about the younger generations who are making healthcare decisions, where do they show up? I think about a lot of neighborhood apps and places where people make recommendations. So people find healthcare through search and through referrals, either through friends and family or physician referrals. And so there are a lot of neighborhood apps and connection apps and social apps that are very active for that, younger consumer, but not so young where they're not making healthcare decisions. I think that's really important to reach those people when they're engaged. I would also say, thinking about content marketing is another very valuable avenue to reach those people. So, for those younger demographics, while they may not be, actively searching for care, if they're looking around content around, should I go to, urgent care for strep throat or for something like that. If you can surface awareness content within the context of what they're reading, display ads, native ads, things like that, that are highly digital, that's a great way to reach those consumers in a way that's more contextually relevant versus just awareness or versus exclusively search. It's a really good kind of medium ground to reach those digitally engaged healthcare consumers.
Okay, another one here. How much are you seeing access being an issue? Also, do you market differently to patients in urban versus rural areas for specialty care?
Good question. So the first piece, access, I'm assuming like technical access or issues with patients accessing the technology. We use kind of a variety of different systems based on our access points. So between our physician practices and our urgent cares and our inpatient experience, the platforms that we use see very little kind of technical difficulties. And then as we've transitioned, very quickly, the learning curve was steep at first, but then I think a lot of patients got on board. In our practices, I think initially before we stood up a solution, providers first were using Zoom and other platforms, as many were, and there were some, I think, technical difficulties there for patients who were unfamiliar with those platforms, particularly the 65 and up generations. However, out of the first 3 weeks, I think the technical issues on the patient side have really declined. People are very familiar now with how to use Zoom or how to use FaceTime or how to do a video chat. So in that regard, very, very little. And then in the urgent care side, we typically see younger, more tech savvy patients. And so really no issues there either. And what was the part 2 of the question?
Part 2 was somewhere. Let's see. Do you market differently to urban versus rural for specialty care?
Yes. So I would say for the direct-to-consumer, no. For a kind of physician extension strategy, yes. So if you are a rural community and you don't have access to a neurosurgeon, we can market our inpatient telehealth service to you to say if you have a stroke patient or a patient who needs a telehealth or a psych eval, you can beam in directly to our specialist. So that is a different approach, but it is more B2B, I would say, than B2C. For the direct consumer, we don't necessarily market differently to the rural areas versus the urban areas, but we do have different considerations for specialties. So obviously there are certain specialties that you can't do a virtual visit for everything. You may be able to do, follow-ups or consults, but there are certain specialties like OB where you physically have to lay hands on people. And so we've set expectations that, primary care and a little bit of cardiology is kind of that sweet spot for telehealth growth. You can only get so far in other specialties where it just, it doesn't make sense, or there's limitations to what you can accomplish in a virtual visit. So yes, we do have a different approach by specialty.
Very good. Thank you. We have one from Kirk. What are your thoughts, or what does your data tell you about telehealth adoption based on provider staff communication versus marketing advertising tactics?
That's telehealth adoption based on provider staff communication. Yeah, so we've experienced this a lot, and it really, again, depends on the care setting. So we have practices where providers are, using their portal to reach out to patients and messaging them and or calling them personally to say, hey, come do a telehealth visit. You don't have to physically come in. Here's how it works, and having that personal outreach. That's very effective in getting patients. I think the difference is really they're just simply redirecting a patient who would have been an in-person visit. So that was really critical, obviously, during a lot of the shutdowns, and not losing that volume entirely. That actual provider or staff patient outreach has been effective, but it's really more on that existing patient relationship piece. For the more kind of direct consumer, we see search as the #1 value channel for us. So that includes paid and non-paid. But if you think about, again, people who are raising their hand right now and saying, I need urgent care, that is the highest converting channel because of their intent. They are searching for you, they're looking for you. So if you show up, you can get, really, really high conversion rates, both on the paid and the non-paid side, because of the intent of that consumer. So again, if you send me an email that says, hey, do a telehealth visit, if I'm not sick, if I don't need to do a telehealth visit, I'm not going to. And so you typically see slower conversion rates or lower impact from those channels in the immediate term. Now, those things can be great, like social or like email to, facilitate engagement or let patients know, hey, we have this available whenever you need us. But in terms of getting people to convert right then, those lower funnel tactics in search have been, extremely effective for patient acquisition.
Okay, thank you. We have one here from Sean Penn. What are the existing measures to evaluate consumer readiness in terms of their digital literacy to help prepare consumers' participation in telehealth visits?
That's a great question. I would say there are, no existing measures. It's really, they're figuring it out. On the provider side, those practices, those physicians, those practice managers have those relationships with those patients. So a lot of times that's happening over the phone. They're calling those patients, a lot of times who are maybe more or less digitally savvy and saying, hey, Mrs. Smith, your regular visit with Dr. So-and-so, it's going to be virtual this time. Here, we're going to send you the link. You click on it. And so I think, at the beginning, it was a lot more of that in-person kind of walking them through how to use it, what to expect. And that's really decreased. On the urgent care side, patients are extremely tech savvy, and, there is little to no kind of walkthrough for patients. It's very much, you check in, we send you a link, you launch your journey. There's not a lot of like readiness capabilities because those types of patients are kind of fundamentally different. It's easier for them to, quickly access a link and log on and do what they need to go. And again, I think that just goes to consumer adoption that's rapidly shifted to, video chat formats in the last, 8 weeks.
Very good, thank you. We have one from Allison. Any differences with regard to mental health services as opposed to primary care? Any particular hot channels for college-age youth and underserved populations?
Yeah, that's a good question. I would say, depending on your organization and depending on how you get patients, primary care versus, behavioral health can be a little bit different. If you get patients from the ER and you need kind of urgent psych evaluations, that is going to be very different than obviously an ongoing relationship with a primary care provider. Or if you are have more of those behavioral health services and you are looking to have kind of regular care and mental health touch points with patients, you would probably treat that a lot more like primary care in terms of engaging with patients, reaching out to them, having them schedule their virtual behavioral health consults. So all of those things are really going to be dependent on your care setting. And in terms of youth and underserved populations, I personally don't have a lot of experience with those. We don't have a ton of practices that I oversee that are focusing in there. I would say from a hospital perspective, there are definitely areas that they're outreaching to those underserved populations, and we have a few behavioral health facilities across our organization that are pediatric that are doing a ton of that, but I personally don't have a lot of background into those.
Okay, thank you. Let's see, is there one digital social media application that seems to be more successful than the others for making conversations?
Making conversions. Yeah, I would say, again, probably lower funnel. So Google search and your Google listings are a great way to get in front of patients and get them to convert. It's not necessarily an app or a social media site, but it is a platform and a channel for patients who are looking for care. I would also say, email is a really important channel. Patients really consistently tell us in the data that they like to be communicated with via email from their doctors. So you think about all these different platforms and channels and portals and ways that we reach out to patients, we forget that email is still a really valuable channel for patients that have an existing relationship with their doctor. So, we've seen really, really good results from reaching out to past patients through email to get them to book an appointment or get them back in for a telehealth visit or to re-engage them. So I would say, those two channels are probably the most effective in our experience.
Okay. Okay. If there are licensure changes that make interstate telehealth easier, There are lots of benefits, but our primary care practices are worried about new out-of-state competition for local patients. Thoughts on marketing response to that? Telehealth as part of community-centered care?
That's a great question, and actually something that we talk about a lot because we have, access points to hospitals, practices, urgent cares across lots of different states, and so that actually would be a really good thing for us. But I know for smaller practices or health systems located in one state, that is a concern. And I would say from a marketing perspective, and really our employee providers have had similar concerns. But the biggest thing that you can do is really provide that great product experience. And by product, I don't mean the actual technology of your telehealth visit. That's important, but the interaction with your provider. So you don't leave your primary care doctor unless you're unhappy or you move. And that actually could be an advantage because if I do move, but I love my primary care doctor and he can still see me virtually, why not? Why would I not keep seeing him as long as he can, take care of my needs and refer me to somewhere I need to go? And so I would say that, for providers and practices that are concerned, that's really where you emphasize the value of the relationship with the patient. It's kind of their job to retain the patient. So marketing brings them to the door and gets them to engage with that practice, with that provider, but it's their job to give them a really good experience to make them, keep coming back. And that really helps mitigate competition. So again, that relationship piece is really important because if I have a great doctor who's easy to work with, they're easy to get an appointment with, they know me, they know my needs. I really don't have a need to do a doctor on demand for somebody that I don't know in a different state. So I see that as all kind of benefit for employee providers as they have the ability to provide those patients with a good experience and to retain them.
Okay, let's see. You said that prescription refills was the #1 demand for telehealth. What about mental therapy? Any insights in growth or demand on this?
Yeah, there's definitely a huge increase just globally in people searching for virtual telehealth resources. And it's, I would say, not exclusive to telehealth. I think it's just people as a whole. And in the search data, it tells us that more people are searching for behavioral health services. Potentially, it's culturally more normalized, it's more acceptable, and more encouraged to get help if you need it or get counseling. So I would say that the telehealth search interest as really a result of COVID. And also the data tells us that, it's easier for patients, less threatening, and also just more convenient for someone to have a virtual telehealth consult. So I think the ease of access for mental health services has really broken down a lot of barriers. So patients who maybe, otherwise would not have been able to, take off work and travel or drive to a therapist's office, they can, have that virtual consult from their home. I would also say price transparency has been another big theme there. If a patient knows that they can launch a virtual, mental health visit for $50, that is, really good than, finding a therapist and not knowing how much the copay is going to be or not knowing if it's covered under insurance or what that office visit is going to cost. The ease of access and price transparency has led to a lot of growth in behavioral health consults on the whole.
Thank you. We have one from Oscar here, and we're running out of time. We're going to try to get to everybody's questions, but if we don't, you can email us and we'll try to connect the dots there. But this is from Oscar. For smaller medical centers and doctors' offices, what would you consider would be the best way to introduce telehealth to their patients?
Yeah, for smaller offices that have smaller patient panel and those long-standing relationships, the more personal you can make it, the better. So if you have staff to do, personal outreach, there's no better way to do that. And it's funny because I do digital marketing, and that seems very old school, but in terms of patient confidence and helping transition a patient who is used to that in-person high touch experience, maybe they aren't digitally savvy, helping them with a real human transition to that and say, hey, I'm going to send you a link. Can you, here's what it's going to look like when you book your appointment, and really walking them through that. What's really interesting too is that, a lot of the data shows that even really young healthcare consumers want that in-person experience or that personal touch, because they may not be, while they may be incredibly digitally savvy, they may not be incredibly healthcare savvy. And so I would say, personal outreach from your provider or staff. Again, email is a really great way to reach out to patients and to introduce them to that. Handing them something in the clinic, is only so good. It's really a matter of that personal outreach, and then communicating the value to them helps them realize, hey, this is, actually something that's going to be great for my experience with my provider.
Okay, we have one here. How do you recommend a brand introduce Instagram to their media plan? Have you done any community virtual programs that allow the patients to form a community within other patients?
Yeah, good question. So I think Instagram is a really good channel to reach that younger audience, and then really trying to build your brand. I would say as a part of a media plan, it's really important to invest in building up your following before you start going out with lots of advertising. So you want to build up your reach. So you can launch campaigns that are specifically designed to increase followers. You can work on other ways to get people to follow you, because you can pay to get in front of so many people, but if you already have a really strong organic following, that amplifies your paid presence on social media. So that's what I would recommend first if you're just kind of starting from scratch. Focus on building up your following through paid and non-paid tactics, and then focus on how to reach those audience with the most effective message. And then the second question, in regards to communities, I think that's really important and something that healthcare as a whole has been, I don't want to say a little bit afraid of, but it happens organically, whether healthcare organizations are involved or not. Patients who are connected on an issue, particularly people who have more rare diseases or specific conditions, they just organically form these groups online. But if you're centering it around your healthcare system and you want to kind of facilitate that, Facebook is a really great platform for that. There are lots of other chat rooms or things like that. Virtual support groups or meetings are another great way to kind of rally patients around one particular thing. But I would say, if you have a way to identify patients who are what I call champions of that, patients who are very engaged, very loyal, you can kind of work through them as influencers. So, you hear about social media influencers and things like that. Using that as a strategy can be really beneficial if you have a great patient story, a great patient advocate. It's always more well received by patients coming from that authentic human point of view about their condition, about their experience, versus a company or a health system or a hospital saying, hey, here's all of our stuff, you should like it. But when it comes from a real human and they're talking about their experience and they're connecting with others about their experience, whether virtual or otherwise, that's really a great way to develop or facilitate those online communities around your services.
Okay, Felicia, thank you so much. Unfortunately, we're out of time. It's obvious how well-versed and how knowledgeable you are, so we appreciate you sharing your expertise with us today. Real quick, I would like to end with talking about our next webinar series, which will be August 20th, same time, and the topic will be telepalliative care by Kimberly Shea, Dr. Kimberly Shea. So check back for registration information there. And if you could, please fill out our survey. This is very valuable to us. It helps us evaluate and let us know where we're at as far as providing information for you out there. So that being said, happy Thursday. Be safe out there. Thank you for your time. Thank you for your attendance. Thank you, Felicia. Thank you for Ray in the background. And don't forget to check out your TRC if you haven't already. Y'all have a good day.